Better tomorrow. Tomorrow. But today, I stand in front of you guys, as he says, we're the top guns, the best of the best. So the presentation I made before, I knew about the Top Gun, but I knew he's very tough on people. He'll be your friend, but he's not going to make it easy. Am I right? Yes. This is yes, and that's a nobody. Just in case. But any teacher I've ever had, the teachers that you really respect, and the teachers that make the most and help you the most learn about life, are always the toughest ones, aren't they? Some teachers I've had, especially if you talked about martial arts. I've been a martial artist all my life. So the meanest, toughest guys I've ever had as teachers, while my head's on the ground, under their foot, going, this is how we kick people in the head. And he looks up and he smiles while I'm in pain. Those are the teachers in life that you always remember because they never gave you an inch. They always made everything in life tough on you. So when you go out into the world, they know they produce something very special. The evolution of human beings, especially of doctors, and where we are today. I did a little brief tour for you that I hope you'll enjoy. So the brief history of medicine goes back how long? Well, we know in recorded history, they have things called cuneiforms. Stone tablets, right? All the way back to the Assyrians. This is the first written account of treatment of illness that we know of in history. Anybody know about the Assyrians? Okay. To understand where you are today, your present, is to read about your past. If you understand the teachers of the past, you'll understand why you're standing here today. And then you have the Egyptians. The Egyptians, when they would treat illness, would have the priest and the doctor together as a team. So imagine a team in treatment. And then 2700 BC, you have the Chinese history, herbology, bodywork, acupuncture. It goes back a long ways. We're talking 5,000 years. And they're people. And the shamans were our doctors of the past. They were our primitive practitioners. They were the medicine men. So basically, you guys are becoming what? The shamans of today. Am I correct? Of course, India, Africa, all parts of the world, all had their primitive form of treatment and illness everywhere in the world. So the question goes to you guys, why are you called to be a doctor in the first place? Why are you here? Do you see your answer up there? Or are you here because of your own illness, your own condition, your own digestive issues, your joint pain, your headaches, your nausea, your insomnia, can't sleep at night? That's why you're here, to figure out yourself? Or some of you will find it's what? It's your own family. Maybe your mother or father has some kind of medical condition, right? They have diabetes. Very big here in Mexico, right? In the United States, it's the seventh leading cause of death. It's diabetes. Here it's even higher. So, maybe you come from a lineage of doctors, meaning your grandfather, your father, your uncle. So what does it take? Does it take just good grades to be here? It takes more than that, doesn't it? What does it really take to be a doctor? Not just a doctor, a good doctor. One that patients see 100 different doctors, but they pick you to come to you, right? Why would somebody want to come to you? Or you? When they look over here and they have all these doctors, why do they come to one of you? Well, maybe they see something in your eyes that's different from the next. Maybe they see that you have what? Focus. No distractions. Imagine, on a bad day, you're going through a divorce, you're sick, there's a hurricane, you're getting married. Do you think you can be focused that day? No. You better be. When you walk in the room with that patient and close that door, that world is out there. You close the door, you're with the patient. What are you doing, a surgery? A chiropractic adjustment? It's one-on-one, right? You can't bring anything into that room with you. It's like stepping on the martial arts. If you step onto the mat and you bow, you leave the outside world behind. A patient, you learn as a student to study, take tests, wait for the next class, all the things as a student. You learn patience, right? But wait till you become the real doctor, as we say, and you got that patient that never gets better, right? Difficult cases, even though you try everything you know, a doctor's been around for a while will tell you, some patients don't get better no matter what you do. Does that mean you're a bad doctor? Of course not. Does it mean you're not using the right technique? Yeah, maybe. But maybe you need to look just a little deeper. Do a little more study afterward about this patient's case and learn something on your own. And sometimes something will come to you just for that one patient, and you go back and they get better. That patient will be your patient for life. So the curtains represent what? Something special. So what I've discovered in my own studies is studying different cultures, people from around the world, Europe, the Middle East, Canada, South America, Central America, is everyone agrees on this. Where you're the local medicine man, the Apache medicine man, there's 5 flows. So you guys are going to study this in school, but let me give you a brief run of this. Digestive tract. There's an in, there's an out, right? Okay, pretty simple. But in the middle, things go wrong, right? From the stomach to the intestines to the colon, people have problems. So you have to have a clear digestive tract, first of all. If you don't open your digestive tract, you're going to have sickness, right? You don't digest your food, you're going to have illness. And then there's what? The lymphatic systems. You ever eat food and you get in your throat? That's the lymphatics. Those are tubes in the body, little small tubes, right? And then there's the meridians. If you study any Chinese medicine, you'll notice that yin and yang, you've heard the terminology, right? Or flows of meridians. They have a direction. Okay? The heart meridian, it flows down the body. So when meridians reverse the flow, you have illness. They use touch, they use needles, they use herbology. Oriental medicine of school does just that. They apply all those things. And then there's the nerves. Those of you here, when you specialize in chiropractic, you can learn that the brain is the big nerve, right? The big nerve in the spinal cord, and all the nerves that go with all the muscles, the ligaments of all the body. So what are the keys to health? If you have a goal with a patient, what are 3 major keys to have? Well, the first one is what? Physical body work. You're chiropractors, you're going to be doing what? You're not going to be doing this. You're going to be touching the body. You're going to be moving ligaments and tendons and muscles. You're going to be adjusting the spine. Chiropractic alone has a very long list. If you look online and search on Google and say chiropractic techniques, endless. Endless. And all you have to do is find one that works for you. Or you may be like me, you may have tried every one of them you see. I'm always seeking a new technique. So what else you need? Chemistry for a healthy person, right? People become what? Toxic. They get toxic chemicals in their body. Maybe they drink some bad water. Toxins from the air. They get sick because of toxins. Their liver gets toxic. Their kidneys get toxic. And then you have deficiencies. People get sick because they don't have a nutrient to support a part of their body. Enough B vitamins, vitamin C, basically vitamins and minerals. But what else do they need? Medications. Believe me, if I fall down and break a bone, I'll be the first one that says, please give me a painkiller. Would you? Or would you say, no, I'm going to try to tough it out. I'm going to be tough. Don't give me pain medication. Right? And then there's the 7 steps. This is something I've learned to develop also from teachers. The 7 steps is this, guys. I'll make it really simple. The digestive system. You need enzymes to digest your food. That's what diabetics don't have, enzymes. Then you need a healthy liver. A liver and a gallbladder. That gets congested, that's the trash can of the body, right? And then people get parasites. They get yeast, they get mold, fungus. What else do they get? Toxic metals, arsenic, lead, cadmium. Okay? And then you need good bacteria in the gut to digest food. And then the lymphatic system. So those are my 7 steps that I use when I look at patients. I'll look at those 7 areas to make sure they're healthy and fine. Their pain really that they have is not that they're in pain from their physical body, it's because their husband just left them. And they're coming to you. What are you going to do? Get better, okay. What are you going to do what? You're going to listen. What do doctors do? Listen to your patient. When patients say they go to another doctor, it says, because my last doctor was not listening. I'm telling you, it hurts right here. And so they're going to come to you for emotional things. And so you'll need to be able to talk to them in a patient and skillful manner to guide them in the right direction, because they're coming to you first. They don't go to a counselor first. They come to the doctors first, right? They always do, because they trust you. They're going to trust that you know where to send them. A cross-body technique is like this. As a doctor, you keep your mind open to anything is possible. And it's just because someone has shoulder pain, and you look here, and you're trying to find what's wrong, and it seems like nothing is wrong. The cross-body is like this. What happens on one side of the body, the other side has to react. Am I not correct? In sports, to be balanced, you have to do what? Cross-body. Right? So whenever you have a shoulder pain, you can't find out what the problem is, you look to the knee. And there's a doctor friend of mine, and we've mapped out the entire body, that one weak muscle right here, infraspinatus, the weak muscle, goes with the sartorius. So it looks like this. They work together. So you go as a chiropractor now, this is a chiropractic work, and you work on this muscle, you make it better, guess what happens? No shoulder pain. And you never touch the shoulder. Imagine that. And the patient will look at you and go, that's weird. Nothing else. So this gives you freedom. What greater thing you can have as a physician is the freedom to do what you want to do. Maybe you decide when you do chiropractic that you mostly want to do chiropractic in your clinic. Maybe that's all you want to do. It's your choice. Maybe you just want to do surgery. It's your choice. But you have the opportunity to do it all. The future is yours. Your hands. You can take your hands and you can write that prescription. You can adjust the spine, perform surgery. And I was asking the other day, y'all are familiar with this from what I understand, MUA. I'm sure you'll explain more. Manipulation under anesthesia. What I spoke of earlier, like touching someone. Presence is the ability of a patient to be in complete pain and complete fear because of what they have, and you simply walk into the room and look at them. And you've not made any physical contact, just you standing in the room with that person, and suddenly they do what? Thank you. We're already better. Have you been around other people in your life like that? You walk into the room and you just feel better being around that person? That's called presence. Some people have the gift of presence. Some have to practice to develop the technique. But the idea is you can develop it, each one of you. Where you simply walk into the room and that person is already less pain, already calmer, or trusting. So that's one of the challenges I'm going to give you guys today is to develop presence of your own. Develop such an attention, a confidence. When you walk into a room, everyone looks at you. And so today, I'm going to leave my talk here, and I'm going to thank you guys first, and I'm going to bow to you as a martial artist bows to a like master, because I see masters of the future in front of me, because you're going to have the power of both, as we say. And when you bow in Japanese to show respect, one person bows, and the next person bows lower. And as I bow to you, I'm going to bow lower to show respect, and I bow to you. Thank you, Dr. Amando.